There are 5 health checkups you should think carefully about once you pass the age of 70, because instead of protecting you, they may actually bring more harm than good. For most of our lives, we have been told that regular testing is the safest path. We sit in waiting rooms, roll up our sleeves, and step into machines, believing that each scan or scope is a shield against disease. But what if that shield is cracked? What if some of the very checkups that are supposed to keep you safe are quietly pushing older adults toward unnecessary treatments, painful complications, and hospital stays that steal away independence? The research is sobering. More than 1 in 3 medical tests given to seniors lead to treatments or side effects that were never needed. Almost everyone past 70 is being tested too much without realizing it. And here is the most shocking fact of all. One of these tests, still offered in clinics every day, has been linked to about 5% of all cancers in the United States. That risk is equal to drinking alcohol every single day. So stay with us until the very end, because the final checkup on this list is the most dangerous of all. It is widely promoted, yet many experts warn it may do more harm than anything else. You won't want to miss it. Before we begin, introduce yourself in the comments, share your age, where you're watching from, and whether you've ever regretted a test or procedure. And if you believe in honest conversations about aging wisely, please like this video and subscribe to the Elderly Wisdom so you never miss what could be truly life-changing. Now, let's begin with the first test, one that looks harmless but can quietly harm your quality of life. The bone density scan. Number 5. Bone density scan. The first checkup on our list may seem like the most harmless of them all. A bone density scan, sometimes called a DEXA scan, is quick, painless, and often advertised as an important step in protecting your bones from osteoporosis. You simply lie down. The machine scans your hips and spine, and within minutes, you are given a number that is supposed to reveal how strong your bones are. It sounds sensible, it sounds safe, yet for many people over 70, this test does not provide protection at all. Instead, it often creates fear, and that fear can lead to treatments that do far more harm than good. Here is the truth that isn't often explained. Past the age of 70, nearly everyone will show some loss of bone density. It is not a disease in itself. It is simply part of the natural aging process, just like wrinkles or gray hair. But the moment the scan labels your results as osteopenia or low bone mass, many doctors feel pressured to prescribe strong medications. These drugs, called bisphosphonates, are designed to slow the breakdown of bone. On paper, that may sound like a good idea. In real life, these medications can trigger severe heartburn, painful inflammation of the esophagus, and in rare cases, even a frightening condition where the jawbone begins to die. Imagine dealing with that when all you started with was a scan that showed nothing unusual for your age. What makes this worse is how little benefit these drugs provide for older adults. A study of more than 1,200 women over 70 found that taking these medications for 5 years lowered the risk of fracture by less than 1%. The improvement was so small that researchers concluded most women would gain nothing from the pills, yet many would suffer side effects that harmed their daily lives. Let me share with you the story of Margaret, a retired teacher from Chicago. At 75, she was active, walking every morning and helping her grandchildren with schoolwork. During her annual checkup, her doctor recommended a bone density scan. She felt healthy, had never fallen, and had no bone pain, but she trusted the advice. The scan showed mild bone loss, and almost immediately, she was placed on medication. Within weeks, Margaret developed severe reflux and jaw pain. She stopped singing in her church choir. Meals became uncomfortable, and she began to fear that her independence was slipping away. Eventually, another physician looked at her history and asked an important question. Why are we treating you at all? You have never had a fracture, you are mobile, and your results only reflect the normal changes of aging. Margaret stopped the medication and began a different path. She started gentle strength training at her local community center, added leafy greens and yogurt to her meals for calcium, and took a small vitamin D supplement each day. Over the next year, she grew stronger, steadier, and more confident. Not only did she avoid fractures, but she also regained her quality of life. This is what many older adults are missing. A scan result does not define your future. Numbers on a page can create fear, but fear should never be the reason we take powerful drugs. Lifestyle changes, resistance exercises, balanced practice, proper nutrition, and vitamin D are far more effective at protecting bones than a pill that may harm you. In fact, research shows that these simple steps can reduce fracture risk by more than 20%, which is far greater than what medications achieve for people in their 70s. So let me pause and ask you, do you already practice balance exercises or light strength training? Maybe you walk daily, or use small hand weights, or even follow a simple routine at home. Comment below with a yes if you do, or a no if you haven't started yet. I'd love to see how many of our viewers are already taking steps to protect themselves in this natural and powerful way. A bone density scan may look like a small, safe test, but for many older adults, it creates more fear than benefit. If you have never broken a bone, if you remain active and steady on your feet, the test may not add any value. Instead, focus on what truly matters: movement, nutrition, and building strength day by day. And here's something to think about. If a simple bone scan can create so much unnecessary worry, imagine what happens when a scan of the brain shows abnormalities that may not be abnormal at all. Coming up next, we'll look at brain MRIs for memory loss and why they so often leave seniors more frightened than reassured. Number 4, brain MRI for memory loss. If the bone density scan can quietly create fear, the next test on our list strikes at something even more personal: our memory. Few things are more frightening for older adults than the thought of losing memory or facing Alzheimer's disease. When someone in their 70s begins to misplace their keys more often, forget names at church, or struggle to recall a word in conversation, it can spark deep anxiety. And naturally, many doctors respond by ordering a brain MRI, believing it will give answers. But the truth is that for most people, an MRI only brings more questions and often more harm than comfort. A brain MRI is a detailed scan that shows the structure of the brain. It is an impressive piece of technology, able to detect tumors, strokes, or serious diseases. But here is the problem. In people over 70, most MRI results show small changes that are perfectly normal with age. Slight shrinkage, or tiny white spots on the scan, are seen in nearly everyone. They are part of the natural process of aging, not necessarily signs of dementia. Yet when a doctor points to those spots on a screen, many patients immediately assume the worst. Fear takes over, and that fear can lead to a cascade of additional tests: spinal taps, biopsies, or even procedures that carry their own risks without improving memory at all. The numbers reveal the truth. A large study reviewed more than 3,000 brain MRIs in adults between 70 and 85 who reported only mild memory complaints. The results were astonishing. 86% of scans showed some form of abnormality. But here is the key detail. Only 3% of those findings were linked to conditions that could actually be treated. That means the vast majority of patients were told something was wrong, when in fact, their brains were aging normally. Even worse, about 12% of these patients went on to have invasive procedures, all triggered by vague and often meaningless MRI results. Consider the story of Harold, a 74-year-old retired engineer from Ohio. Harold had always been sharp and organized, but in recent years, he noticed that he misplaced his wallet occasionally or forgot the names of neighbors. His doctor, concerned, ordered a brain MRI. The scan showed small white matter changes, which were explained to Harold as abnormal. Panic set in, convinced he had early dementia. Harold stopped driving, withdrew from his local church group, and began living in constant worry. Yet when he was reassessed with a simple cognitive screening test, a short paper and pencil exam, his results were well within the normal range for his age. What had robbed Harold of his confidence and joy was not dementia, but the fear created by a test that was never truly needed. This is why experts now recommend a different approach. For most older adults with mild memory concerns, a cognitive screening test is a far better first step. These short evaluations measure memory, attention, and problem-solving skills without the expense, stress, or risks of an MRI. Combined with lifestyle improvements, better sleep, hydration, physical activity, and brain-challenging games, they provide both reassurance and practical ways to strengthen mental health. So let me pause here and ask you a question. Have you ever forgotten a name, misplaced your keys, or struggled to remember why you walked into a room, and immediately worried that it might be something serious if that sounds like you? Type the words, "That's me," in the comments. You'll find you are not alone, and we'll respond with tips that can help. Memory changes are one of the most common fears of aging, but they do not always mean decline. Many times, forgetfulness is simply part of the natural rhythm of life. A brain MRI may show changes, but those changes often reflect nothing more than the passing of time. Instead of rushing into scans, we can focus on daily habits that keep our minds sharp: regular movement, deep sleep, social connection, and challenging our brains with learning and puzzles. These are the true protectors of memory. If MRIs can plant seeds of fear where no disease exists, imagine what happens when a test convinces seniors that their heart is failing, even when it is not. Coming up next, we'll look at the cardiac stress test, one of the most common exams ordered for people over 70, and one of the most misleading. Number 3, cardiac stress test. If brain scans can leave people frightened about memory, heart tests can do something even more dangerous. The cardiac stress test is one of the most common exams given to seniors, especially those who mention feeling tired, experiencing mild chest tightness, or simply not having the same energy they used to. The idea behind the test is simple. Place someone on a treadmill or give medication that makes the heart beat faster. Then watch what happens. Doctors use it to check for blocked arteries, believing it will prevent heart attacks. But here's the truth. After the age of 70, this test often causes more problems than it prevents. The main issue lies in accuracy. For older adults, the stress test is notorious for producing false alarms. In fact, studies show that the rate of false positives, results that say there is a heart problem when there is not, can be as high as 40% in people over 70. Imagine hearing that your heart may be in danger, only to go through additional testing, procedures, and even surgery, all based on a mistake. Yet this happens every day when a stress test result looks suspicious. Doctors often order an angiogram, a procedure where a tube is inserted into the arteries to look for blockages. And once a blockage, even a mild one, is found, the pressure to fix it often leads to placing a stent or even recommending bypass surgery. But here's what the research shows. Many of these procedures do not extend life or improve quality of life when the patient had no symptoms to begin with. Instead, they add risks of bleeding, kidney injury from the contrast dye, infection, and long hospital stays. Take the story of Thomas, a 76-year-old retired postal worker from Florida. Thomas stayed active by walking his dog each morning and helping his grandchildren with errands. During a checkup, he mentioned that he sometimes felt tired when climbing hills. His doctor, wanting to be cautious, ordered a stress test. The results were unclear, so Thomas was referred for an angiogram. A mild narrowing was found, and a stent was placed. That night, Thomas had a bad reaction to the dye used in the procedure, which led to kidney problems and a week-long hospital stay. The fatigue he had complained about never improved, because it wasn't his heart that was the problem. It was simply dehydration and the natural fatigue of aging. This is why experts now recommend more careful use of the stress test in older adults. If someone is not experiencing clear warning signs such as chest pain during activity, shortness of breath with light exertion, or dizziness while walking, then a stress test may be unnecessary and even harmful. Safer options include a resting EKG, which looks at the heart's rhythm while sitting still, or a coronary calcium scan, which measures plaque buildup with far less risk. So let me ask you, when was the last time you had your heart checked? Was it a stress test, an EKG, or something else? Share your experience in the comments below, and let us know how it went. Your story might help another senior who is facing the same decision today. The lesson is simple. Feeling tired does not always mean your heart is failing. Aging naturally brings changes to stamina and energy. Before agreeing to a stress test, it's worth asking your doctor a clear question. If this test shows something, what happens next? If the answer is another test, a procedure, or a surgery that may not be needed, it may be time to consider safer alternatives. Stress tests were designed with good intentions, but for many older adults, they serve as a doorway into unnecessary medical care. And while heart procedures carry their own dangers, the next test on our list is one you probably know very well. It is recommended for nearly everyone, but after 70, it can quickly turn from helpful to harmful. That test is the colonoscopy. Number 2, colonoscopy. If the stress test can lead to unnecessary heart procedures, the next checkup may surprise you even more. The colonoscopy has long been considered the gold standard for detecting colon cancer. For decades, adults turning 50 have been told that this test is essential, and many continue repeating it every 10 years without question. On the surface, it sounds like the responsible choice, but once you reach your 70s, the balance of risks and benefits begins to shift dramatically, and in many cases, the risks start to outweigh the rewards. Here's why. Colonoscopy preparation is often very hard on older adults. It requires strong laxatives that clear the bowel, but this can cause severe dehydration, dizziness, and even kidney problems. Then comes the sedation, which is often overlooked but carries a real danger for seniors. Medications used to put you to sleep can affect memory, slow down recovery, and in some cases, trigger confusion or delirium for weeks. Finally, there are the risks from the procedure itself. Bleeding, tearing of the bowel, and abnormal heart rhythms during sedation are all well-documented complications. What is most concerning is how little benefit remains after a certain age. A major study looked at more than 1 million Medicare patients aged 70 and older. For every 1,000 colonoscopies performed after age 75, only about 2 lives were saved, but more than 20 people experienced serious complications. That is a 10-to-1 risk-to-benefit ratio, and it is a sobering reminder that more screening is not always better. Let me share the story of Patricia, a 72-year-old grandmother from Texas who ran a small family bakery. She had no digestive symptoms, no family history of colon cancer, and had already had 2 clean colonoscopies earlier in life. Her new doctor, eager to be thorough, encouraged her to do the test again. Patricia agreed, thinking it would be routine. During the procedure, a small polyp was removed. That night, she developed severe abdominal pain, collapsed at home, and was rushed to the hospital. Doctors discovered a perforation of her bowel, a rare but serious complication. She spent more than a week in recovery, lost weight, and never felt quite the same afterward. The most heartbreaking part was that her previous tests had already shown she was at very low risk. The repeat procedure simply wasn't necessary. That is why current national guidelines now recommend stopping routine colonoscopy screenings at age 75 for most adults. For those who are in excellent health, safer alternatives exist. One of the most effective is the FIT test, a simple at-home stool test that checks for hidden blood. It requires no prep, no sedation, and no hospital visit, yet still catches most cases that need attention. Another option is the stool DNA test, which is non-invasive and can be mailed to your doctor. These tests provide peace of mind without the heavy risks that colonoscopy carries in older age. So let me ask you, Have you ever had a colonoscopy? If you have, type the word colon in the comments below. It will be interesting to see how many of us have gone through this common test, and we'll share tips about safer alternatives for those entering their 70s and beyond. The key takeaway here is that not every polyp needs to be removed in later life. Many grow so slowly that they are unlikely to cause problems, and chasing them can sometimes create greater harm. Colonoscopies have their place, but after 70, it is wise to have an honest conversation with your doctor about whether the test is truly necessary or if a simpler option will do. And now, we arrive at the most controversial test of all. It is marketed as a powerful tool to catch disease early and is sold in glossy health packages across the country. Yet behind the promise lies one of the most dangerous practices for seniors, the full-body CT scan. Number 1. Full-body CT scan. Of all the checkups on this list, the full-body CT scan is perhaps the most tempting and the most dangerous. It is often marketed as part of executive health packages or offered in private clinics as a way to catch cancer early. The idea sounds reassuring. A single scan that looks at your entire body, hunting for hidden problems before they can cause harm. But here's the shocking truth. For older adults, these scans are far more likely to create problems than to prevent them. The first concern is radiation. A full-body CT scan exposes you to an enormous dose, equal to about 500 chest X-rays. That amount is not harmless. Recent research suggests that CT scans may now be responsible for up to 5% of all cancers in the United States. That means 1 out of every 20 cancer cases could be triggered by the very test that was supposed to protect you. It is a sobering reality, and one that few clinics mention when they promote these scans. The second concern is what doctors call incidental findings. As we age, our bodies develop harmless little changes, tiny nodules in the lungs, cysts in the kidneys, or calcium deposits in the arteries. These are often a normal part of aging and may never cause trouble. But once a scan reveals them, they set off alarm bells. More scans follow, then biopsies, and in some cases surgeries, all to investigate spots that were never dangerous to begin with. Consider the story of Edward, an 80-year-old martial arts instructor from California. Edward was still active, teaching classes to younger seniors, when he decided to purchase a full-body scan at a private clinic. The results showed a 3-millimeter nodule in his lung. His doctor, alarmed, ordered a PET scan. Then came a biopsy. The result, benign. But the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery. Edward lost strength, missed his classes, and endured stress that could have been avoided completely. All of it started with a test he never truly needed. This is why experts are so firm in their recommendations. The American College of Radiology has stated clearly that full-body CT scans should not be used for routine screening in people without symptoms. There is no proven evidence that they save lives, but there is overwhelming evidence that they can cause harm. If you do have symptoms such as unexplained weight loss, coughing up blood, or severe pain, then a targeted scan of the specific area makes sense. But scanning the entire body with no clear reason is like searching for treasure in a minefield. You may find something, but the cost of what explodes along the way is often greater than the treasure itself. So let me ask you directly, have you ever been offered a full-body scan as part of a special health package? If you have, I'd like to hear about it in the comments. Share whether you accepted it or declined, and what your experience was. Your story could save another senior from going through what Edward endured. Here is the guiding principle. Listen to your body. If you feel well, stay active. Eat wisely, rest deeply, and maintain regular conversations with your doctor. Testing should be focused and purposeful, not broad and fear-driven. Our health is not protected by chasing every possible problem on a screen, but by nurturing the habits that keep us strong and independent. We have now covered 5 checkups that can create more harm than help after 70. from bone scans to brain MRIs, from stress tests to colonoscopies, and now the full-body CT scan. The lesson is the same. Modern medicine is powerful, but it is not perfect. And when it comes to aging wisely, sometimes less testing truly means more life. In just a moment, we will wrap up with some final thoughts on how you can approach your health with wisdom and confidence. And I will leave you with a simple question to ask your doctor that can change the way you think about every test. Final thought. We've now walked through 5 medical checkups that may look helpful on the surface, but can actually bring harm once you pass the age of 70. The bone density scan, the brain MRI, the cardiac stress test, the colonoscopy, and the full-body CT scan. Each of them carries risks that are rarely explained in full, yet they are still offered to millions of older adults every year. The message is not that medicine is bad or that doctors do not care. Medicine has saved countless lives, but more testing does not always mean better health. In fact, when the tests themselves trigger fear, unnecessary treatments, or dangerous side effects, they may quietly take away more years than they give. After 70, the real question is not how many tests can I have, but rather, which tests will truly help me? There is one simple phrase you can carry with you into every appointment. Ask your doctor, if this test finds something, what happens next? That single question forces clarity. If the next step is another risky test or a treatment that may not improve your life, then it may be worth pausing. Real prevention does not come from chasing every possible disease with machines and scopes. It comes from what you do every day. Staying active, eating nourishing food, sleeping deeply, laughing with friends, keeping your mind engaged. These are the foundations of health that protect not only your body, but your spirit as well. So I want to hear from you. Have you, or someone you love, ever gone through a test or treatment that turned out to be unnecessary? Share your experience in the comments. Your story might give another senior the courage to ask questions and choose wisely. And if today's video gave you a new perspective, please like it, share it with a friend, and subscribe to the Elderly Wisdom. Together, we can build a community where aging is not about fear of disease, but about the joy of living fully and wisely.